Hello, Mr. Hurt. My name's Brandy. I'm back. We did your assessment earlier, and I was looking at your orders, and it seems your doctor has written for me to do a dressing change. Dressing change on abdominal incision. Okay, so I'm going to take the old dressing off. I'm going to cleanse the wound and then put a new dry dressing on. Is that all right? It is. Okay. Can you tell me your name? I'm Hurt, and date of birth, 1234. And our MRN number is 88109-530, and that matches. Okay, so everything's good to go. I'm going to gather my supplies and wash my hands really quickly. Are you in any pain right now? No? Okay, yeah, we did that pain medication with your physical assessment about an hour ago. Can you rate your pain 0 to 10? It's a 3. Okay, is that tolerable for this procedure? Yes, it is. So I'm going to grab... Oh my gosh, these are all open. 3 packs of 4x4s, 1 ABD pad. My sodium chloride expires 12/20/18. I'm going to use my marker and write date, time, and initials because it's new, and I'm going to open it. All right. Mr. Hurt, do you have any allergies? No? Okay, good. Have you noticed any irritation on the skin surrounding this wound? No. Okay. Now for me, my tray table, I always put it usually over the bed some, okay? I want it as close to the wound as possible. Okay, that's great. I'm just going to grab it. You don't want to expose you, so I'm going to cover your legs, and I'll take the blanket off when I'm done if you like to be, if you don't want any covers on. Alright, well, my curtains are privacy, my room door is shut. I'm going to lift my bed because I don't ever want to lean over the wound, and if your bed's not at the appropriate height, you will be leaning over the wound. This bed's awesome. Fun ride there, right? Alright, get a couple pairs of gloves. I'm going to grab 3 pair. You can do it in 2 if you want. And I'll show you the process for both. Okay, I'm going to pull your gown up. All right, looks like this was just changed yesterday at 9 o'clock, so about 14 hours ago. And the doctor wrote for it to be changed every 24 hours, once a day, so we're good. So first things first, put on our clean gloves and remove the old dressing. And you always want to tuck the tape inwards as you pull it up so that it doesn't re-stick to the patient, okay? On these mannequins, it's not as bad. It comes up really easily, but on patients with that very delicate skin, I'm going to make sure it's not. Alright, so all my tape's there, and I'm going to grab the dressing. So we're not forcefully grabbing, but we do want to make sure we get all the gauze off. Okay, and I'm going to look at my dressing. I am noticing if there's any odor. So this is going to be probably, I don't know, 40% saturated on 2 4x4 gauze. Okay, it doesn't look like it's gone through to the abdominal pad. And then I'm going to wad it up. And this is what we call double gloving. So that dressing's in there. If it's not completely saturated, this can go in regular trash. It does not have to go in biohazard. Oh my gosh, this is why I don't wear wedding rings. Okay, so I'm looking at this wound. We've got 6 staples and a Penrose drain. I'm going to pretend like the Penrose drain is not there because you shouldn't have that in checkoff. It should just be the simple wound. It's well approximated. There is slight redness to the wound. I'm about to palpate, and I want you to watch. I'm not going to cross over the wound to palpate, so you should never cross over the wound for any procedures. And as I'm palpating, I'm checking for any induration or tunneling, and then also for temperature, okay? So top to bottom. Okay, good. I'm going to pull off my second pair of gloves and get ready to clean this wound. Again, not crossing the sterile field. My gauze is sterile, so make sure when you're opening it, your hands are not on top of the gauze at any point. Try to use new supplies when you're practicing these skills because it's very different opening new supplies. Okay, put on my gloves. Actually, and you'll also notice the angle of everything. My table's not off to the side because I should not turn my back to my wound at any time. We should have eyes on everything. Alright, so to clean the wound, this wound probably doesn't need cleaned, but it's part of the procedure, so we're going to do it. So what I do is the wonton. I'm going to move this. So peeling up from the side. So I'm not going to touch with my gloves anything, any part of the gauze that will be touching the wound, okay? So I'm going to do the wonton. So I'm just going to fold up the corners. Okay, cap should be opening up. You shouldn't place it down. And just pour a little bit of NS over your gauze and wipe one side. Trash. Your other wonton. Wipe. Same thing, wonton for drying. Dry. Dry. And then no touch technique for placing the gauze. So just pick it up and drop. And don't move it around because you don't want to move anything from the outside into the wound because you're manipulating the gauze. Now your ABD pad is folded, so you just pick it up. The blue stripe should be up and place it on top. Then we're going to tape all the way around. And don't use the patient as a table when you're date time and initialing. I'll borrow a pen. You can take your gloves off at this point once the wound is covered to do your tape if you have trouble with. So I'll just show you. Right now I'm date time and initialing this piece of tape with the pen I have in my pocket. Tear it off. Put it there. Alright, Mr. Hurt, that wound looks really good. I would assume we're probably not going to do too many more dressing changes. We'll just leave it open to air next time the physician looks at that. But for right now, I want to make sure when you're coughing or doing any strenuous activity, you're doing what we call splinting. So you can either just use your arms or use a pillow to cover that incision, so there's not too much stress on there. Also, you're not allowed to get in the shower or bath right now with this dressing unless we cover it with like a piece of saran wrap that'll protect it from getting wet, because we don't want that dressing getting saturated. If you are experiencing any pain, if you feel any coolness or feel like anything tears, or if you notice any drainage on this wound, please let me know as soon as possible. Was that procedure okay? Any trouble with that dressing change? No? Okay. Do you want this sheet left on you? Yes, okay. Well, I will do that. I'm going to wash my hands and go document. You're a phenomenal patient for that procedure. And it looks good. Okay, can I get you anything when I come back? Your lunch? Okay, I'll see where your lunch is at. I'll check on it. Thank you.